Hi, Dr. Pelto here. I want to talk a little bit today about a patient that had developed some right plantar fasciitis pain, and she had developed this after falling off a mountain bike when she was mountain biking. This isn't unique. This was a 35-year-old female. She went mountain biking, fell off, kind of hurt her calf, and then a short time after that started developing some heel pain or plantar fasciitis. And I'm going to talk a little bit about what I think the cause was for this patient. And I'm going to talk about the different types of treatment options that this patient had. So we're going to go through a little bit of plantar fasciitis. Okay, so I'm going to start by showing you a picture here. So I'm going to show you a slide deck. Okay, this is an example of what I like to use for explaining plantar fasciitis to patients in the office. What happened after her accident? She developed a lot of tightness in the back of the calf. This is kind of the back of the calf. This is goes down to the Achilles tendon, and she had a lack of movement. So when I tried to lift up her foot, she was not able to get it up. It was very, very tight. And many of our patients, when they can't get their foot up, they put their foot out. So instead of going up, they twist it out, or they kind of walk like a duck. If you think about it, they walk with their feet out like a duck. And this was the cause of this tightness. And then as a result of this tightness, she developed plantar fasciitis. And so the way I explain this to patients is that if this tendon on the back is very tight, it's going to pull up more and it's going to pull harder on the bottom of the heel, causing the plantar fascial symptoms that she was feeling. And the best way of treating this is a combination of treatment. So at the first visit, what I normally do for these patients is I have them use something to loosen up the tightness in the back of the calf. And that's usually foam rolling and stretching. But I like foam rolling more because many people stretch the wrong way. The same way that she doesn't have the ability to get her foot up, when they stretch, they put their foot out and they take the pull off of the Achilles. With foam rolling, it's a little bit better. So you can foam roll on the ground, you can foam roll against a wall if you can't lift yourself up. So that we'll talk a little bit more about that. The other thing that this patient is going to do is she's going to take a 2-week course of anti-inflammatories. Many patients, when they come in, they only take anti-inflammatories like as needed, but I find a 2-week course at a therapeutic dose can help heal these better. Now, I don't think it's alone by itself, but I think in conjunction with the other treatment, it's very, very effective to get down the inflammation. And along with that, they'll do icing and contrast baths. Another thing I like to share when patients are dealing with heel pain, specifically this one here, if they develop heel pain right here, this is the fascia, which is about 3 millimeters thick. I say it's kind of the thickness of a thick piece of bacon. And if it doesn't get better, it starts to get thicker, right? So 35-year-old female, which I saw, they don't tend to have a lot of plantar fasciitis thickness yet because of their age, but it can develop thickness if it doesn't calm down on its own. And the challenge with the fascia is inserting into a bone, and neither of those have really good blood supply. So most of my focus is on getting the blood supply better. Another slide that I share patients much of the time is showing a normal thickness of the fascia. This is an ultrasound probe, something that we do in our office. And I can look at the fascia and I can see normal thickness, and I can see that this one's a little bit thicker and it's darker. It's black, and that means that there's swelling in there. This is the best diagnostic test. This really helps me determine if the patient needs a cortisone injection or shockwave treatment. What I find with my patients, I tend not to start with this. I'll start with an X-ray. And then at the next visit, if they're not getting better, then we will consider doing the shockwave or cortisone, depending on it. So she started out with an anti-inflammatory. I use Celebrex, 100 milligrams twice a day. That's to reduce the inflammation. I'll go on to this. This kind of explains how I start with patients. So with patients, I talk about what's most effective and what's least effective. Most patients, before they come and see me, they've tried stuff underneath this yellow line. And there are treatments that can reduce pain, reduce tightness, and then reduce the stress going through the foot. And when I see patients, they usually try what's underneath the yellow line before, but they're not very effective. So in this case, she had tried anti-inflammatory, she tried icing, some stretching, over-the-counter arch supports, she tried some new shoes, and none of that worked. So when someone comes and see me the first time, I'm going to kind of make sure they do a therapeutic dose. She had tried some anti-inflammatories, but not at a therapeutic dose for 2 weeks. So I start with that. I have them do icing either for 10 minutes twice a day, or contrast baths. What is a contrast bath? It's a bucket of water with ice in it, one bucket with ice water and one with hot water, and they'll kind of move back and forth. That's how they do contrast baths. They do that once a day as well. She started with that. And then at the follow-up, I'll decide if she's going to do a cortisone or she's going to do shockwave. Also, she had tried stretching. I don't really find stretching all that effective if people aren't doing it right. I recommend doing a combination of a night splint and home therapy. I'll explain that. A night splint is something that we dispense in the office to her. The reason I do that is if patients have pain getting out of bed in the morning, which she did. She had pain getting out of bed. Now the night splint, a lot of our patients, they can't wear it all night long. They will wear it only when they're resting at the end of the day for 2 or 3 hours. And if they can try to wear it at night, but some people, if they're side sleepers or stomach sleepers, they can't tolerate the night splint. So she did a night splint. We got that through her insurance, and she's going to do home therapy, which is foam rolling on the back of the calf. I find that very, very effective. And then if it's not getting better, the next step would be going to physical therapy for her. And then finally, she had tried over-the-counter arch supports, some things like this. And I think the best thing is to take the pressure off the area of the fascia to offload with a high contouring orthotic. So she's going to do a custom orthotic. She already had appropriate shoes. And the home sandal I recommend is an UFOS sandal. So this is how we're starting with this patient. She's going to be doing orthotics. The orthotics usually take about 4 weeks to make. I'm going to make a follow-up with her at 3 weeks. The reason I do that is I have her try the anti-inflammatories for 2 weeks and then take a week break to really see how everything else is going. When she comes in, the orthotics might be in, and then at that time, I'll do a diagnostic ultrasound. And with that, if there is a lot of thickness, I'm going to recommend shockwave therapy. That reduces the inflammation in the area by sending your own body's like stem cells in there. And based on the ultrasound as well, we may do an amniotic stem cell injection. And then finally, if there is no thickness and it's just a little bit of swelling around that, then we would consider cortisone. I don't do as much cortisone now for plantar fasciitis because it tends to last about a month or two, and then the pain comes back. And so that is kind of the treatment of choice for plantar fasciitis for this patient. I think this treatment process tends to work pretty well. If you want to learn more, underneath this video, I'm going to put a link to a page on my website. It's actually the same patient resources that I give to my patients. It's a page specifically, it's kind of a hidden page on my website, but I'm going to give it to you. It has all the resources here. Then there's also a course that I put together. Maybe you can't come and see me in Massachusetts, but there's a course. I'm going to put a link to that. It's an online plantar fasciitis course. I think you'd find it beneficial as well. I'll put a link to that underneath this video. Okay. Once again, post any questions or comments underneath. I will try to answer them as I can and do other videos accordingly. So if you're riding a mountain bike. Now, going back to the mountain bike, why do I think that happened? Well, I think it wasn't the fall from the mountain bike. I think it was the fall caused her to have some muscle tightness or soreness, and that just didn't allow the calf to work as well, and so it restricted the movement, and that's what caused it. Wasn't per se to the mountain biking activity. But bikers, they tend to have tight calves, and that can really contribute over time to the heel pain. Okay, hope you guys found this beneficial. Thanks.